definitely some kind of inflammation going on. Now we get to the thyroid markers. You remember we talked about TSH. We like to see it between 1.4 and 2. Yours is at 2.37. So that is pointing to hypothyroidism, which is really common with high cholesterol. Because as I mentioned, when the liver's backed up, it's not filtering on cholesterol out of the blood. And it's also not able to keep up with that thyroid conversion. So they both, when the liver's not working, a lot of things in our body don't work. And those are two main signs of that. Free T4, we like to see that between 1.4 and 1.8. So yours is low at 1.02, which is also pointing to that sluggish thyroid, as well as iodine deficiency, because iodine is the building block to the thyroid hormone. So you need to have enough thyroid hormone to do that conversion anyway, right? So one of the things I do with my clients is I tend to, we have a kelp supplement that's a really gentle form of iodine, because I know some people try to do like iodine therapy, and that can be really, really dangerous to do on your own. So we always start with the kelp, which is, like I said, a gentle form of iodine to help shore up that, at least the building blocks for the thyroid. And then of course we work on the liver and the gut issues so that the thyroid can actually be turned into the usable form and be used throughout the body. Hemoglobin, A1C, so we like to see that between 5 and 5.3. Yours is at 5.4. So again, pointing to this iron deficiency anemia. Also, like long-term, could potentially be diabetes if the insulin resistance isn't resolved. And then vitamin B12 serum, we like to see it between 800 and 900. Yours is at 1414. So that could point to things like a vegan diet, low stomach acid. We often see low stomach acid as a result of an H. pylori infection, because H. pylori neutralizes the stomach acid around it, basically making it so that your stomach doesn't have enough stomach acid to break down your food. And then that results in nutrient absorption issues, because if it's not broken down when it gets to the small intestines, then you can't absorb it because your immune system doesn't recognize it as food and starts creating inflammation, because it puts these little histamine bubbles around it, because it's like, this is an invader. And it then shuttles it off to the liver, and the liver gets backed up. It's a lot of information, but it's kind of like this whole cascade of issues that could happen.